Welcome everybody to today's session. My name is Dale Tomlinson. I'm a member of the Customer Success and Engagement team here at Thrive Mental Wellbeing, and it is my pleasure to be joined by Pamela Thomas today on an important topic. And today's webinar's title is Understanding Eating Disorders. Before we jump into the webinar, I'm going to give Pamela the chance to introduce herself in her own words, and a bit about your background, Pamela. And yeah, we're really excited to learn more about you.
Great, thanks so much, Dale. My name is Pamela Thomas. I'm a PhD researcher at University College London in the Division of Psychiatry. Thank you so much for inviting me to talk about eating disorders in the workplace. I think it's a topic that's often misunderstood, and I think it affects a lot more people than we realise. So I've worked with Dale to design the session really to help you get a better understanding of eating disorders, no matter what perspective you come from, whether you work in HR and your job's around sort of policy development, whether you're concerned about a colleague, or even if you have some concerns about your own eating disorder behaviours yourself. In terms of my background, as I say, my background's sort of in psychology. I worked in industry myself within pharmaceuticals and consulting for a number of years. So familiar with I guess some kind of workplace issues, which we might touch on later, which might be I guess concerning for people with eating disorders. And then moved into academia a number of years ago. And I think with my background in mental health, I identified there was a real kind of issue around treatments available for eating disorders. So I guess that's been sort of my life's work and my motivation going forwards to try and improve access and availability of treatments to people struggling with these often misunderstood and sort of invisible conditions, which have a serious impact on individuals and in the workplace and society, which we'll talk about more later.
Thank you, Pamela. Yes, it's been a real pleasure working with you to put this webinar together, and I can really I've really sensed your passion for this topic as we've been putting this session together. I'm really excited to learn more as well. Obviously, I have learned some as we put this together, but I'm really excited to learn even more today, and I'm sure our audience is really looking forward to this. As I said, a really important and, dare I say, perhaps still taboo topic in many ways, I think. And so, yeah, I'm really excited for this one today. In terms of what we're going to cover in today's session, quite a wide range of content to get through, so I need to spend less time introducing and more time jumping in. But today we're going to learn a bit more about eating disorders. Actually, what is an eating disorder? How common is an eating disorder? How many people experience them? What that experience looks like? What the symptoms, the behaviours, the impact of an eating disorder. And then we're going to talk about support and treatment. What do typical treatment pathways look like? How accessible is that treatment? And how can we as colleagues, as friends, as partners, support other people, in particular in the workplace? How can we foster an atmosphere that encourages and supports people experiencing an eating disorder, and how we can be more inclusive within the workplace? And so I guess really the big question, Pamela, what is an eating disorder?
Yeah, so first off, I think it's important to understand that eating disorders, are really serious kind of mental health conditions. They're not lifestyle choices. They're psychiatric conditions which are potentially life-threatening, and they're really characterized by disturbances in terms of behavior, thoughts, and attitudes. They disrupt individuals' kind of daily life, and they have impact on individuals, significant impact on their families and carers, and also in the workplace and society as a whole. I think some of you may have heard of a number of different kind of eating disorders. They might be terms you're more familiar with. There's sort of anorexia nervosa, which is more about sort of restrictive behaviours, over concern sort of with shape and weight, and very kind of controlled and rigid behaviours around sort of thinking about food, and calorie control and so on. That affects about 1% of the population in terms of prevalence rates. Bulimia is characterized by binge eating, then often followed by some kind of compensatory behavior afterwards. This could be purging, it could be laxative misuse, but also overexercising is something kind of very common in some people with eating disorders. Binge eating is similar behaviours, that kind of repeated cycle of kind of binging, but without that compensatory behaviours, which is really the most common of the the main eating disorders. Then we have this category called OSFED, which is sort of this hold-all bucket category. OSFED stands for other specified feeding and eating disorders. A little bit unsatisfactory, really. It's the most common eating disorder. It's been estimated in the literature to be about 50 to 75% of eating disorders. And essentially, it's that group of people whose kind of don't meet the diagnostic criteria for any of the other categories. Maybe it's that their cluster of symptoms really don't quite meet the criteria, or it could just be that they are sort of subclinical, not quite meet the kind of clinical kind of threshold. But essentially what this kind of tells us is that there are a lot of people who might be struggling with an eating disorder, not really understand what they have, and also, a huge issue with kind of underdiagnosis of eating disorders, just because of this sort of confusion and this broad category of this kind of OSFED. I would like to just touch on ARFID. It's an increasingly sort of mentioned eating disorder. It is slightly different insofar it's not associated with sort of overweight, over concern with shape and weight, but it involves kind of more restrictive eating patterns and food groups, more related to kind of sensory experiences, or maybe experiences in the past relating to a certain food. So again, thought I would just kind of have it on the radar, because there are some people do need support. It's more recently kind of mentioned within the press and so on, and there's starting to be kind of some support groups out there who can help with that.
So looking at the prevalence of some of these more common eating disorders, what a quick calculation looking, what would you say is sort of the expected amount of the population here in the UK that are living with an eating disorder?
Yeah, so sort of, I'll give you a couple of statistics out there. I mean, Beat is the main eating disorder charity. So they estimate that around 1.25 million people are struggling with an eating disorder.
Wow.
In terms of prevalence rates, it's been estimated that about sort of 8 to 9% of females, maybe about 2.5% of males will struggle with an eating disorder in their lifetime. But I think we just have to think a little bit around onset of these conditions, typically as kind of teenage years, maybe a little bit later for sort of your bulimia or binge eating can be a little bit later. But typically, I think if you think of the kind of workforce or your employees, you could think that maybe around, say, 8% or something of them might, have an eating disorder. But then more broadly than that, there are estimates that around 16 or so percent of people might be struggling with their eating behaviours anyway, which is having an impact on their life, but not have an official diagnosis of an eating disorder.
Yes. And so I guess you've given us a little bit of an insight into what some of those eating disorders look like. And when we first started designing this session, we talked a little bit about, I guess, the portrayal of eating disorders in the media. For me, whenever I've seen it referenced, I remember sort of teen TV shows and kids TV shows. It's typically bulimia is kind of the one that's talked about most, but actually looking at that statistics, it's not the most common behavior within, and not the most common eating disorder.
Yes, I think you're right there. I think often it's portrayed, you may have these images or these stereotypical images of who really kind of suffers from eating disorders. And often I say we think of the kind of young white female is this sort of stereotype, but we're going to bust these myths today, Dale, that it isn't. It can affect anybody, no matter what gender, age or ethnicity which you are. And yes, binge eating disorder is actually the most common of the eating disorders. I can talk a little bit more detail in that if you like, but I think with binge eating, there's this repeated sort of cycle of binging to deal with difficult situations as a coping mechanism in life. And I think, a lot of people don't necessarily recognize that these behaviors around lack of control around eating, or what's sometimes called emotional eating, is actually a sort of psychological problem which needs to be addressed through techniques such as CBT. What I've heard from my experience is that often these people, one, they wouldn't think about going to see a doctor to get help because they don't understand that it's a psychological kind of problem or what's driving these behaviors. I think secondly, if they do actually I guess pluck up the courage, there's a lot of stigma associated with eating disorders. If they do go and seek help, often they're sent to weight management clinics, which isn't the sort of solution, when they actually
Mm.
more kind of psychological support or therapies, which
Mhm.
again we'll probably come on to later when we talk about treatment.
Yeah, it's interesting. On the slide here, it says it's often associated with over concern with shape and weight, but it's not specifically only that. And actually, myth busting to an extent. You just mentioned that some of the most common eating disorders, are not strictly associated with shape and weight at all.
Yeah, I think just what I wanted to sort of address with this slide is just really to help people understand, or increase our understanding about what eating disorders are.
Mhm.
And I think it's really understanding that it's not primarily on food. Food is really the sort of what people use in the same way that other people may use even alcohol to deal with
Yes.
difficult situations and things which are going on with their life. So
Mhm.
they use food to block out maybe difficult thoughts, maybe really overwhelming feelings. I've spoken with people, with lived experience, who sometimes use food to deal with sadness, to deal with difficult situations. Also, individuals, who deal with it to cope with stress at work. Actually, can be a trigger for these behaviours.
Mhm.
So I think it's really important to understand that, yeah, these are behaviours which are being used as a way to deal with underlying problems which are going on in their life, and it's these underlying problems which we need to understand better and to deal with at a more kind of fundamental level. The other thing which I would say, I think it's very important to then help individuals with eating disorders develop different strategies.
Mhm.
A lot of the challenges in the short term, they can provide temporary relief. So they actually work. So you might get people being quite reluctant to give up these behaviours because they're working for them. But the problem is the
It's very
longer term
interesting.
consequences can be really quite severe in terms of the health consequences of the individual, um,
Mhm.
and also in the workplace and so on. So it's a really kind of downward spiral, and it becomes very difficult to break over time. So what we need to help people do is gain and develop more kind of healthy coping strategies to deal with the difficult things going on in their life and manage that stress and so on.
Absolutely, that's really interesting that you mentioned that for a lot of people, it feels like it's a functional. It's a functional. The eating disorder has a function,
Yeah.
and therefore changing that behavior when the function is determined by the individual that it is successful to an extent, and that actually this does make me feel better, is a
Yeah.
really hard behavior to break.
Yeah, and I think a metaphor I've heard is almost like it's a band-aid over like a really kind of sore wound, that it
Yes.
provides that kind of temporary relief, it alleviates the pain in the short term, but you're really not addressing that underlying problem, and that's where the work needs to be done.
Yeah, and as you referenced alcohol as an example, there's and I guess it's one of the keys of fostering that judgment-free approach to eating disorders is that many of us, and probably a majority of us, have some form of maladaptive coping mechanisms for the things that make us insecure, that make us feel threat, that make us feel distress. Whether it's something as simple as I chew my nails when I get nervous, like that's a coping mechanism I always had. It's not a great one, really. Like I need my nails, I bite them down too low sometimes and it hurts. And that's on a smaller scale, that is a maladaptive coping mechanism for distress. And in terms of judgment, this is just another one of those maladaptive coping mechanisms that as you said, it feels functional to the individual, but unfortunately we know the side effects of it are severe for general health.
Exactly. And I'd just add that, and the difficulty is we have to eat every day. So
Yeah.
it's a daily struggle with some of those other things, those behaviors. You can do things and try to stop. You can,
Yes.
whereas with food, it's always there, it's always present. And dare I say it, which we'll come on to, often workplaces are quite food centric. You may not really realize at a surface level, but as we delve a little bit deeper, I think we can discuss a little bit more some of those interactions, or ways in which food is present in the workplace, and how that might be experienced for someone struggling with food.
Absolutely, it's something we don't think about, but yes, food is vital, isn't it? We can't live without it, and so there's and it's very casually interwoven with social experiences, within our families, within social circles. It's often the case that I'm actually away from home right now. I've been at an event for the last couple of days, and what we're doing after work. Well, let's all go get a bite to eat together. It's the natural social experience of humans is to eat together, and therefore it's an important thing that we can't really escape, and that we often are socially pressured into participating in. Can only imagine that it's a really hard thing to avoid once that it becomes the coping mechanism, and it becomes a constant source of challenge for the individual.
Exactly. But hopefully later we can brainstorm a little bit, maybe
Yes,
ways in which we can create that kind of social fabric in that community in the workplace, which don't rely on food so much.
certainly. And so why do eating disorders happen, Pamela? Big question.
Complex. Eating disorders are more complex than you realise. And actually, when you talk to people, their own individual experiences of it are really quite different. What I would say is there are a number of different causal factors which interact to contribute to an eating disorder. So we have, a mix of biological, genetic, and environmental influences. So, for example, someone may have, a genetic vulnerability towards it, but then combined with life experiences such as, family pressures, societal pressures to look or be a certain way,
Mhm.
maybe some trauma or difficult experiences within their life. These things can then combine to make someone more likely to engage with an eating disorder. I would just like to highlight, I have highlighted one in a Thrive friendly colour, taking a green from your colour palette. This is to reflect the environment.
Yes.
And I've highlighted this one because this is what we're mainly kind of talking about today. This is kind of the workplace. And I wanted to emphasize that, the workplace, it is a key influence on someone, the likelihood of someone developing, or an environment with which someone can be either supported towards recovery, or it can intensify their insecurities around food, around appearance, and so on. So, I think it's important to know that it can be a positive or a negative environment in which someone can be more likely or help people kind of
Mhm.
work towards recovery. I'd just like to say one paper had quite a nice quote. I think I said, depending on how stress is managed, the workforce can act as a bridge or a barrier to eating disorder recovery, which I think was yeah, obviously very relevant for today's session.
Mm. And what does the role of early years upbringing genetics play in? If a parent has an eating disorder, is there a higher likelihood that their child will develop one?
Yes, yes, of course. I think that there are a couple of factors I think at play there, aren't there? That's
Mhm.
obviously then the genetics. There may be a heritable kind of component. There is quite a lot of work being done to really get a better understanding of the mechanisms via which that occurs.
Yeah.
But I think also, obviously, it's inextricably linked with the environment then within which an individual grows up. I have spoken to, individuals with eating disorders, and they talk about that. They talk about pressure around meal times, and they may talk about parents who talk about weight, talk about appearance, weigh themselves regularly. But I think also I found that. I think it's worthwhile mentioning. Sometimes it's also high achieving families where individuals feel a lot of pressure on
Yeah.
them to be a certain way and to succeed. So people with a trait commonly associated with eating disorders is perfectionist tendencies.
Mhm.
So
And
if you're brought up in that environment, again, that can be an influence and make someone kind of more likely.
and therefore, undoubtedly, would it be accurate of me to suggest that perhaps even the sort of the rise of social media has played a role in creating that harder environment?
Yeah, exactly. So, yeah, on the right hand side, social media, a lot of kind of research and publications are out there demonstrating the negative influence of social media on people's kind of perception of body image,
Mhm.
increasing those body image kind of concerns. Um, so, yes, I think it's very important. Very important. Again, there's a lot of education, which some of the charities do around helping people understand. I think we're all aware of the use of filters within people's kind of images often, or
Mhm.
a very distorted portrayal of what their life really looks like. And I
Yes.
think it's
Yeah.
all about that education and media literacy, isn't it, around what's really kind of going on there. But yes, definitely.
Certainly, and I know when we were sort of planning this session, we touched on, and the next section we're going to touch on kind of the prevalence and demographics and who's most effective, who's
Yes.
most affected. But interestingly, I shared some experiences of some friends of mine who've been involved in bodybuilding as men in their early 20s who ended up becoming diagnosed with an eating disorder. And again, it was similar, same influence as what we would stereotypically box it as for, young girls going on social media and feeling that pressure, which, we're going to challenge that stereotype a little bit. But certainly, it doesn't just affect what we might stereotypically expect. And I've had friends who become involved in bodybuilding and felt the pressure of around diet, the fear of one slice of pizza, what's that going to do to me? How's that going to harm me? But also then the pressure when they see people on social media who, you know, are not honest about steroid intake, as an example of getting really big muscles, and that kind of the perversion and the lie that comes through social media then affecting that individual's eating habits, creating disordered eating, and then potentially an eating disorder. So certainly, yeah, I think it's maybe a good time to move on to who is affected, and maybe challenge some of our ideas a little bit around who we expect are the most affected people.
Yeah, so I think so. I think just touching on what you just said with social media, we are seeing an increase, unfortunately for males as well, is,
Mhm.
a representation of what an ideal male physique looks like. So
Yeah.
often, a driver for males and a contributor to the increase in eating disorder behaviors in males is this desire to have this very lean, this very ripped, this very muscular sort of physique. So it's a slightly different sort of goal they're aiming towards than often with the females, which is about
Yes.
achieving a very kind of lean, very slim sort of look. But it's all about, as you alluded to, with the kind of bodybuilding and
Mhm.
developing this sort of six pack sort of image, which is putting
Yeah. Yeah.
pressure on the males sort of as well. And yeah, and often I think a focus on diet as well. I think that's just the other thing to touch on with the sort of social media. People talking about what diet they have, how they, what they eat, and food portions and that kind of thing.
Take breakfast with me, that kind of thing. Yeah.
Yeah, a huge amount of misinformation as well, which we need to be very mindful of,
Yeah.
imperfect diets and all this sort of thing. Um, so yeah, in terms of who's affected, I mentioned, yes, it can affect anybody, no matter what gender, what age, or ethnicity as well. At the moment, it's estimated that 1 in 4 are males. I think that's on the increase.
Mhm.
I would mention on males, I think, and again, I've spoken to quite a lot of males with experience of this. There's a lot of stigma,
Yeah.
a lot of stigma. I think particularly when I spoke with males actually from different kind of cultural backgrounds or different ethnicities, it's almost like a double whammy there, where they actually
Mhm.
feel it's totally taboo, as you mentioned, in their culture, but also it's a female-centric sort of issue. But I think with all of this, it's to know you're not alone. Okay, you're not alone. There are people for you to talk to, people struggling. We'll talk at the end. Have some signposting in terms of charities
Mhm.
who also have males you can sort of speak to with lived experience. But yes, it affects sort of anybody. Eating disorders do not discriminate, as we've touched on. The causes, a lot of them are biological or genetic or something. Yeah, anyone could sort of be sort of affected. Yeah, so just to talk to the slide a little bit, based on these sort of estimates, we thought it might be helpful to really translate that to what that might represent within your organisation. So as a benchmark, we took an organisation with 2,000 employees and just applied those sort of prevalence rates in terms of what that might look like for you.
Mhm.
As we've mentioned, these are often highly stigmatized, so quite invisible conditions. So just to be aware how many people within your organisation might be affected. So we estimated, so based on the research data, that around, oh, apologies, typo, 168 females may have an eating disorder, and based on that 1 to 4 ratio, 44 males. Um,
Mhm.
and then in terms of a broader, people who are having problematic eating, disordered eating behaviours, a further 240 females and 80 males may have, problematic disordered eating behaviours, but not meet the official criteria for a diagnosis. So that's sort of what we've reflected in the bar chart.
I guess that prompts the question: what is the difference then between an eating disorder and what we would call disordered eating?
Yeah, so this goes back a little bit to what we spoke about at the beginning of the presentation. I think
Mhm.
about not meeting sort of diagnostic criteria or diagnostic thresholds.
Yeah.
So individuals, disordered eating, as I talk about, if it's maybe slightly subclinical, maybe you don't binge sufficiently frequently enough to have an official diagnosis, but
Mhm.
it is that you're at a high risk of developing an eating disorder. But also, it's just being aware that people with disordered eating behaviors, we should be aware of them. They also may need help because they are at risk of developing and also maybe impacting on their life, on their quality of life. So yeah, just important to kind of have that sort of distinction there.
Absolutely, and that kind of takes us into the next question. What is the impact on life of a mental health condition? And I know, Pamela, you've interviewed many people and are part of research projects that are, not just looking at how we better treat and support people with them, but of really understanding what is the day-to-day impact for somebody with an eating disorder.
Yeah, so I think firstly, let's to be very serious here. These are very serious mental health conditions which have very serious consequences. Sort of firstly, they have the highest mortality rate of any mental health illness. And also, it's estimated there's a huge burden of illness associated with disability, estimated at 3.3 million life years. There are also a number of other physical health consequences which can actually happen in the short term and also the longer term, including cardiovascular issues, osteoporosis, bone density sort of issues to do with lack of nutrition. I'll pick on a sort of a lesser one, fertility issues. Again, when I've spoken with people who actually, sadly going through, fertility treatment because of longer term consequences of their eating disorders and being very unaware that this might be a consequences, and it can affect both males and also females in terms of sort of fertility. Because binge eating, you have this repeated cycles of binging without the compensatory behavior, kind of unsurprisingly, it's highly related. 1 in 2 to 3 individuals are obese, and obviously being obese, then you have a greater likelihood of having cardiovascular issues, diabetes, and cardiovascular disease. So a lot of physical consequences to bear in mind in the short term and sort of the longer term, some of which are irreversible. Secondly, I think looking at, we need to look at the psychological kind of consequences.
Yes.
So in terms of the day-to-day life, so fatigue, concentration difficulties, weakened immune function, chronic health problems are also kind of common sort of problems. And I think also I would just say not to underestimate just the quality of life impact on individuals.
Yeah.
It's actually quite heartbreaking when I talk to people and they talk about how it's really impacted and affected their life and their low self-esteem and their lack of habits and impact on their social life, on their families, on their relationships with their children. It's very significant and really can't be underestimated. Not to mention in terms of the kind of workplace, I think I think the average income is lower. They're far less
Yeah.
likely to hold on to a job because I think it's difficult because of having to have hospital appointments. And just because of obviously not feeling at their best and being able to perform at their best within the kind of workplace. So yes, I think that there are a lot of kind of consequences, but a number of kind of different levels. And then not to mention, I think, maybe some people today have people within their families, I think as carers as well. The
Yes.
consequences, the ripple effects of this, it's not just the individual, the ripple effect is kind of very sort of significant.
Yeah, I mean, it goes back to what we were saying earlier, doesn't it? That where, a lot of the holidays and festivals and days off that we celebrate are often built around an iconic food, a meal. And, you know, for that individual who's experiencing the eating disorder, that's not a happy, Christmas dinner might not be a happy thing, which we all look forward to. And, we all think about, if you talk about what's the classic thing you enjoy on Christmas Day, a lot of people will say sitting around the table with my family having Christmas dinner. And actually, those classic life events that we look forward to, that we take pictures of and that we reminisce about, are heavily
Exactly.
tied to food.
It's very difficult, as you say. A lot of time with family and friends is around celebrations, it's around festivals, now Christmas, now Easter, now birthdays. They're very, very stressful times for people with an eating disorder.
Yes.
Catching up with families, I've spoken to multiple people, whose mothers or families show love through food.
Yeah,
And
no, definitely. My cultural background is certainly love through. Couldn't go to my nana's house without being force fed. Absolutely.
Yeah, it's very difficult. Or can you imagine, on your birthday, not being able to eat the birthday cake or whatever. And I've had, I'll never forget talking to someone and they said to me, I think I shared with you this before, I ate a sandwich and nothing happened.
Yeah.
And that really illustrated, gave me goosebumps, illustrated to me, gosh, the real impacts that this actually has on individuals, and then yeah, the control which it can really take over their lives.
And then you have to, I guess, also consider the lengths that individual will go to protect their family and if your mother or your parents or your grandparents or whoever it might be shows love through food, and you don't want to feel like you're rejecting that, you put yourself in more harm's way to protect them, and then those events are harmful to you, but you'll take steps if you want to keep that disorder to yourself, where you put
Yeah,
yourself in harm's way to protect other people as well.
yeah. So I think from what you said, I think it's just also important to sort of, hopefully today is maybe, you know, some people will get a better understanding of just what that individual is going through, and actually eating that sandwich or sharing in that meal. It is a big deal for them. It is something they have a huge anxiety related to. So yeah, so we'll move on to talking a little bit about kind of conversations, but it's not saying just eat a little bit more. It's not about trying to encourage them to eat sort of the food. It's
Yes.
trying to address and talk about it in a different, very kind of supportive way to help them kind of open up about their
Yeah.
difficulties.
Absolutely. And you referenced kind of the impact in the workplace for an individual, economically speaking, um, average lower wages, but also impact, as you can imagine, in terms of absenteeism, presenteeism in the workplace. Talk us through what that looks like, Pamela.
Yeah, exactly. So, as I've said, eating disorders, they don't stay at home. They show up at the workplace in a number of different ways. So, in terms of, the research suggests, significantly higher rates of absenteeism than people without eating disorders. And that can be time away from work due to illness, medical appointments, sometimes even hospitalization. Um, and also, I think maybe even more significantly, they show significantly higher levels of kind of what we call presenteeism.
Yeah.
So that's really kind of being at work, being less productive due to symptoms such as struggling to concentrate, feeling fatigued, and working whilst unwell. And I
Mm.
looked at one research paper which kind of tried to quantify that. And this was, bear in mind, this was for non-underweight binge eating. So not the kind of severe anorexic sort of type, but your non-underweight people more with binge eating behaviors, so you like bulimia, whatever. It estimated that around sort of 7 to 8 days per year, higher rates of absenteeism. In terms of presenteeism, it estimated 57 days
Wow.
a year in terms of, yeah, not really performing, not really feeling well
Mm.
at work. So quite a significant impact if you think in the workplace. I think then we also kind of need to bear in mind the impact on teams, on team productivity, on team morale.
Mhm.
As I mentioned before, this kind of ripple effect. Maybe you get team members trying to kind of pick up some of the workload. And I think also just managers really struggling to know kind of what's going on, how they can help, just affecting a team productivity, morale, and workplace performance. And I think, at a broader level, I've just shared some data around the overall cost of the UK economy. It's estimated in the multiple billions,
Yeah,
so
yeah.
factoring healthcare costs, productivity, wider societal impact. So I think whilst really important to help the individual in their personal struggle with it, we also really need to bear in mind there are significant impacts in terms of financial impacts within the kind of workplace. So yeah.
Certainly. I mean, if you look at anxiety and depression combined, I think Deloitte estimates anywhere between 40 and 50 billion.
Yes, I think
And
so.
that's a combination of two of the most common mental health conditions. And so it does show just the scale of the impact on the individual and how that kind of manifests itself in the macro as well when you look at the collective impact.
Exactly. And I think these, again, bearing in mind the underdiagnosed, the lack of understanding, this potentially could be an underestimate. And I think we'll move on, probably as is the case also, though I'm less familiar with those other conditions you mentioned. But if untreated, they can get worse.
Yes.
So, um, again, we'll come on to what you can do in the workplace. But I think the cost and the impact on the individual in the workplace, if we can create a healthier, more supportive culture, and help signpost people to get help earlier rather than later, that will
Yeah.
obviously benefit everybody.
Yeah, that was a really, in our discussions ahead of this meeting, that's something that really stood out to me is that the later we intervene, the harder it is to help.
Yes. So I mentioned earlier around those kind of, cognitive and behavioral process, they become very ingrained, they become habits. And once it's a habit, they become neurobiologically kind of wired in the brain,
Yeah.
very hard to break. Um, and research suggests that those sort of first 3 years, almost like a critical window, whereby the likelihood of making a full and quick sort of recovery are that much greater. So early intervention, definitely, as is the case with other mental health.
With lots of conditions, absolutely. I'm looking at this funnel on the right-hand side of the screen, and to me, that funnel seems concerning in terms of the number of people who are able to get the help and recover. Can you talk us through a little bit more about kind of that how we arrive at those numbers and whether I'm right to be concerned about that?
Yeah, sure. Good. I think it communicated what I hoped that it would. But I think, yeah, I just wanted to talk through a little bit some of the challenges and the systemic issues around the treatment of eating disorders. So we have this high, relatively high sort of prevalence rates. Eating disorders are not rare; they're affecting a lot of people kind of already. First, we've mentioned this high levels of stigma. In terms of seeking out. Some of it is a lack of understanding in terms of what they are. I think both in terms of individuals, society, sometimes also in terms of GPs, and meeting those kind of diagnostic criteria is also kind of a difficulty. So I think we need to get better at that. There's a big kind of drop off in terms of people seeking help. Also, there's a big problem in terms of sort of services and capacity within the NHS.
Yes.
Prioritizing, sadly, you mentioned early intervention, but they're having to prioritize the most severe cases. That means there's a significant population out there who are actually not getting help. Beat did a survey, and that's where that 31% came from, that actually 69% of people who went to their GP to seek help, 69% of them didn't get help because they didn't meet the kind of criteria.
Wow.
But they went to actually go and get help. And then in terms of recovery, again, this is sort of an estimate based on treatments. Around 50% of those who get treatment, often because they get treatment later, then maybe not necessarily as effective, but again, because treatment needs to be tailored and personalized sort of to the individual, the success rates of some of the CBT therapy is around sort of, it has been around sort of 50%. But what you're finding, the 3.3% sort of illustrates of those who actually have a sort of an eating disorder, you're finding sort of a lot of kind of issues which result in quite a small percentage of actually making sort of recovery. The other thing I just wanted to mention, sorry, Dale, can I just sort of
No.
is also, I think it just also, I wanted to highlight the point that also this means that in the workplace, there are going to be people on waiting lists for treatment who've been to seek help, who are not getting help. So they're sort of struggling with these sort of things. They're going to be there. So whatever, we can do or you can do to actually, help them go and understand more about their condition, go and signpost them to actually go and help and create this kind of supportive environment. And then also, direct them to programs or, such as obviously Thrive is one, through the app or through the counselling services they provide. That would be great.
Certainly, I think a worthwhile exercise, we will get onto some do's and don'ts, definitely, but as a workplace is do crunch those numbers and think about, well, how many people in my workforce may have an eating disorder, how many people are going to seek help, how many people are going to get access to treatment, and consider the resources you do have, whether it's Thrive or whether it's private medical insurance, whether it's income protection, whatever it might be, and consider, and understand what level of support is there for eating disorders within those products that actually that you may not be aware of, that promoting those may be the opportunity for someone to seek further help. They may have got to the GP and the door slammed shut, but actually there may be alternatives elsewhere. And so certainly as employers, a vital thing to understand will be where within our ecosystem does support for eating disorders exist. And if you can briefly summarize, you mentioned, tailored CBT as an example of some of those treatments. Is that the most common treatment for an eating disorder?
Yeah, sorry, I glossed over that a little bit. So NICE, which probably you'll be sort of familiar with, who presents sort of guidelines in terms of the evidence base and what they recommend of treatment. So it's cognitive behavioral therapy for eating disorders as the primary treatment approach.
Mhm.
For adults with bulimia or binge eating disorder, self-guided CBT is actually suggested as the first line sort of treatment. So this is
Mhm.
where some of these kind of earlier, lower intensity interventions, such as apps, for example, may be more sort of suitable, and sort of can provide support, because they address those sort of, I said, those underlying sort of psychological sort of processes which underpin eating disorders. So yes, CBT is very much the recommended treatment for people with eating disorders. Obviously, if someone has, anorexia or whatever, then the kind of multidisciplinary team approach, where more kind of specialist involvement is actually sort of, required.
Brilliant. Thank you for sharing that. And so, as this is themed around the workplace, how can I've mentioned one way in that workplaces can be more aware of what services they have that do support eating disorders. What else can workplaces do to be more supportive?
Yeah, so here what I try to do is sort of create sort of a more kind of practical framework, I guess, to help organizations think, okay, what can I do at what sort of
Mhm.
level to help support people sort of better? So I've sort of created kind of 3 different levels of support. So if I just go through these in turn, level 1 is those more general things really, which you can do to create kind of healthy work environment. It's more about kind of prevention, inclusion. I think probably by the fact that many of you are here, that's great. I think you're really kind of considering, how to create a kind of, a healthy sort of culture for people with mental health, and I think with eating disorders. So I think we just need to kind of review what we're doing through the lens now. Now you've increased your understanding of what eating disorders are. Look at what you're sort of doing. So it could be that maybe you have some kind of, weight management sort of programs within your. So again, thinking a little bit, those weight-centric programs aren't very helpful in this sort of context. So maybe just thinking maybe they need to be very carefully sort of targeted, so they're oriented around the right individuals, and not more kind of general approach. Yeah, I think it's again having an open, healthy sort of culture where people feel comfortable, talking, around their concerns, around maybe their workload, around stress, what's really impacting on them and work, which is affecting their kind of well-being. And I think more specifically, we touched on food.
Yeah.
So thinking, are our social events oriented around food? I've worked in organisations, again, you're right, where we celebrated, inviting pizza lunch on a Friday, the boss will buy everyone
Mhm.
pizzas, goes, you'd hear your dominate menus. Terrifying for someone with an eating disorder, bringing in the Krispy Kremes on the birthday, all these sort of kind of things. Hopefully now you're a little bit more mindful of. So just thinking, how can we make it more inclusive? How can we make it
Yes.
more comfortable and safer for people?
Mhm.
Some people might be there working on their recovery. So it's just being mindful of those sort of things. Yeah, I'll get into some of the more specific, I think, in the do's and the don'ts.
Yes.
I'll touch just on just one other sort of specific thing. I mentioned people can be associated with very low self-esteem and low morale. So again, within a healthy work environment, I'm sure some of you do already, but recognise support, having individuals really feel valued, because this is where some of this kind of stems from, this this overthinking about shape and weight, just through low self-esteem and perfectionist tendencies. So just helping people feel valued as within the workplace. All these things could be really helpful and really kind of preventative. I mean, a surprisingly huge amount to someone struggling with.
Absolutely. Yeah, yeah. I mean, I was reading some research recently around sort of the increase in workplace burnout, and appreciation was one of the top things, which is actually we can help people in a lot of ways by, by building up people's self-esteem. When they do something good, we shouldn't treat it as, well, there, that's your job. We should treat it, we should be mindful of the fact that we can support and help people when they do good things by telling them what a good job they've done.
Yeah,
And
I think
who
it's
knows what the
huge.
impact that is.
And the praise the individual, the team morale, and I think
Yes.
on workplace performance and loyalty. You'll have a loyal, productive kind of workforce if that's the thing you do. Just moving on a little bit, I think level 2 is making sure we support those, with the earlier sort of symptoms or so on. So
Yeah.
providing access, as we've mentioned, to employee assistance programs, clear signposting to professional sort of services, and just encouraging help seeking without sort of stigma. And if people need to take a bit of time off for an appointment, that kind of thing, just making sure you're sort of flexible.
Yeah.
And then obviously at third level is making sure, this will always be a few number, hopefully it's not too many, but just making sure you've got the right policies and protocols in place to support those who need, more urgent support. So guidance to managers on where to escalate concerns,
Mhm.
clear policies around sick leave and that kind of thing. And potentially, think about links with external, healthcare providers, just so you can support
Yes.
that smooth transition when someone really is in a bit of a crisis and needs that urgent help.
Absolutely. There's very few circumstances I can think of where it's better for a business to force somebody to miss out on access to treatment and milk more time out of them at work, because at the end it's a fool's economy, and at the end if someone becomes unwell and takes time off work, you've lost you've lost that person's talent and their ability while they're unwell. And so certainly something we always talk about at Thrive is making flexibility for doctor's appointments, for treatment, that the individual feels they can still work, and that work has their back and is allowing them to access that treatment. And so I can't think of a circumstance where it's better for their business to make someone not have treatment during work hours. It just doesn't make sense to me. And so, yeah, not that we should be sat here diagnosing people, but what are some of those typical sort of signs of an eating disorder at work?
Yeah, so we just thought this would be helpful. Yeah, so in terms of those signs at work, as I mentioned, they could be kind of more cognitive. So just noticing a little bit that, someone's, seems quite distracted. Their concentration doesn't seem to be sort of there. Fatigued, potentially quite socially withdrawn. Can be, a sign. I think just also some behavioural things as well. Not
Mhm.
engaging so much, team activities, obviously social activities, um, some quite obvious ones, bathroom breaks, that kind of thing, skipping meals, can be sort of signs of these things. So I think here, as we say, we're not trying to diagnose, it's just being aware of these things.
Yes.
Maybe there's an underlying issue there, right? Maybe there's a conversation to be had in a very kind of supportive, non-judgmental way, just to
Yes.
help understand what's going on for that individual. Can you help? Yeah, I
Yeah,
mean,
I mean, it's certainly the case that you shouldn't sit someone down and say, "Have you got anorexia?" But it's are you okay? It's just looking out for that individual, and if they know there's someone who's got their back and is willing to check up on them,
yeah.
they may say, "Actually, I've been going through this," and then we can make the adjustments to help them. And so it's being aware, not to diagnose, but certainly to be, if you see those signs, just to check in with that person and make sure they're okay. Treat them like a human being that you care about, ultimately.
Exactly. So, and yes, and just avoiding conversations around weight or food or things like that. Just checking, what's going on for you. How, is there anything you can do? Is it work? Is it workload? Is it stress? That
Mhm.
kind of thing. And then obviously offering them additional support in a sensitive way as appropriate.
Certainly. And so, what are the do's? What should we be doing to help people who, I think we've touched on a couple of these already, but workplace wise, what if you could transform the culture or the practices of any business, what would you be telling them to do from today?
Yeah, but I think, again, great. It's great you're here. Great. I think, as I say, it's a taboo topic. There's a lot of lack of understanding, really, in terms of what eating disorders are, how they affect people in the workplace. So, yeah, sort of first off, I think, it is at that sort of first level, just trying to have an open, healthy sort of culture,
Mhm.
stigma free, where people feel prepared to kind of talk about it. And yeah, just very simple, easy things which you can do around, say, around that sort of that food element. Um, are important. Yeah, obviously flexible schedules for medical appointments, just having an understanding that people need medical appointments. We've training managers to recognize the signs. Again, just being empathetic and understanding. I think a lot of these
Yes,
tie back to the same sort of messages we're sort of trying to get across as well. Uh,
certainly.
and just knowing what level of support you can provide. It might be access to confidential counselling. We've touched on boosting self-esteem, sense of value, inclusive team activities, um, and private spaces or so on. I say we just wanted to just give you with some practical tools really coming out today, not to just increase your understanding, but also to just give you some tangible things with which you can take away with you and think about. So yes,
I
food.
think the don'ts are the ones that I think generally speaking, most workplaces, most managers, most people, if we have our humanity, it's almost to tell us they're experiencing these issues. We would want to help them and support them, but I think it's the don'ts that we get the most wrong.
Yeah, I think that's a really fair point. Just being really aware of the don'ts, because to be honest, people aren't necessarily aware of them. You know,
Yeah.
why would they be? I've worked in this field for a number of years. I'm acutely aware of the don'ts.
Mhm.
Um, but um, but yeah, just being mindful, and these small things, I say, can be very significant for someone with an eating disorder. Even insofar as, I think, you know, I gave feedback. The initial sort of slide which we presented today, I think, with the meals, again, my heart jumped a little bit because, you know, there was food there, and you know, but I think, you know, we decided to keep it because it illustrates this is what happens in the workplace. We do have food, we do have social events in this way. So again, maybe just to kind of question question.
Absolutely. I think one thing you mentioned was around eating on camera as well, which for me,
Yeah.
I don't like sitting there watching somebody eat a meal anyway. The best of times, it's not particularly nice. If you're not eating at the same time, it's not always nice watching other people eat. But I think certainly is one which hybrid remote working, we don't all eat lunch at the same time. We don't all go for lunch break at the same time. And it's often the case where we're jumping from one meeting to another. We've got a piece of fruit or a sandwich on the go, and we're trying to be ultra efficient and effective. And it's something maybe we don't consider because it's just a picture. I'm just, I'm far away from that person, but actually, I can certainly see how adopting good practice around that would be really beneficial. Where someone may think, I'm working from home and in a safer space, but actually then it uninvited comes into the room via Zoom or Teams, whatever it might be.
Yeah, I think that's it. I think yeah, eating on camera can be triggering. I just also wanted to touch on a couple of things. Obviously, we work in a very hybrid world these days. So again, there are still things which can be problematic. Eating on camera is one, and also I'm just mindful. I don't know what time people have lunch, but I'm also mindful. Lunchtime or meal times might be times where someone are trying to build a more regular eating pattern.
Mhm.
So just mindful, asking people, is that okay for you? Does that work all right for you? Would you like, just being sensitive around. I know it's difficult in a busy work day that sometimes, you fit things in around lunchtime. But again, just being mindful. Um,
Absolutely. And so this was a slide that we were really determined to put front and center in sort of the conclusion for obvious reasons. As we mentioned, accessing support for eating disorders is challenging. That whether it's the stigma and an individual being fearful of reaching out, and we see this across the mental health spectrum where there's also a lot of mystery around what treatment looks like and trepidation around speaking to another person around that kind of experience. And so, Pamela, please do tell us about these organizations and how they can help people.
Yeah, so I wanted to share with you two, gosh, fantastic organisations. Kind of in awe of the work they do. Actually, they fill a huge gap in terms of, sort of the treatment and the services available. So the first is Beat. Some of you may be more familiar with. It's a better, well-known one. Sometimes they do quite a lot of work in terms of lobbying government and so on. But the other one is First Steps, who I actually personally work with more closely. Yeah, they both provide a number of different sort of services and actually kind of support groups. I think a number of different days of the week they have different sessions tailored for individual eating
Mhm.
disorders, eating sort of problems. They also run sessions for carers as well, and yeah, they do absolutely brilliant work. So if you want more information, don't hesitate to get in touch with them. Quite a lot of people at First Steps and probably Beat also have been through it themselves. A lot of peer support sort of workers as well, including males. So I can't speak highly enough of the work which they do, and yeah, they'd be more than happy, to talk to. If you would need to talk to somebody who actually understands, what you're going through, they're the people to kind of speak to. And I say they run a whole host of different kind of groups and sessions, which hopefully you or whoever needs help should be able to kind of sign up for. And touching just on Beat as well, if you're kind of anxious, I know there's a lot of stigma to talk to somebody. Even just they do online webinars.
Mm.
So you can just, have it online. You can be anonymous in your conversations or so on. So really, don't be afraid to kind of reach out and ask for help if you need it.
To add to that as well, I did have some slides about Thrive, but I'm going to dispense of them because we've got 6 questions in the Q&A, which I'd rather try and tackle. But Thrive is also a great option. For those who have tuned in today who are Thrive customers, you have full access to the Thrive Digital Mental Health Service. We've touched on some of those treatments today. Self-guided CBT as a sort of an initial option that sits within our software only proposition. For those who have access to our therapy service, we do have therapists who have experience in supporting people with eating disorders as well. It's a completely anonymous, confidential service, and I encourage you to reach out. If you'd like to help to access a service, at the end, I'll put on a slide with our QR code so you can download. To get your access code, it would be speak to your HR team, or you could also reach out to us and I'll pop an email in the chat for you to reach, or Ella could pop an email in the chat for you to reach out to. But Thrive's certainly a great option. I know, Pamela, you've been doing some work with our team around I won't give too much away, but I know we've been doing work around developing some very specific eating disorder treatments as well. Now, I wanted to focus on some of the questions in the Q&A as well. And so we have a few questions which I'll share for you, Pamela, to hopefully give us some answers to. For somewhere where you might want to have more in-depth answers, again, don't hesitate to reach out to us over email, and we can take those separately as well. So one question or comment around diet culture, can that harm people? I think we certainly covered that diet culture within social media, within friendship groups, etc., certainly is that environment that can contribute towards the development of an eating disorder. We do have a question, which is, what if the person doesn't have psychological issues but just has an overwhelming urge to eat, isn't able to find the willpower to fight against the urge? I mean, one thing we actually, in the preparation for this, Pamela, we actually did talk about how there are, we say it isn't the food, but there are also hyper processed, ultra processed foods do make it harder. Certainly, where where there's hyper palatable, high sugar, salty foods and stuff that can make it harder to make the food more damaging. But I guess how would you respond to that question?
Yeah, I think it's an interesting one. I think it goes back to this idea of thinking that, it is down to willpower, which I've tried to sort of, I guess, challenge really a bit with this presentation, that eating disorders aren't about, it's not about that. It's not about not being able to kind of control, what you eat and not having the willpower to be able to do so. I think if someone's experiencing the urges to experience certain food, I think we need to kind of look at that more closely, and I think
Mm,
really kind of unpick where that's sort of coming from.
yes.
And I think it sounds if someone has those kind of behaviours, really to kind of maybe talk to a therapist, really to really, get a better understanding in terms of kind of what's really kind of going on for them. So
Thank you. The next question was less of a question and more of a comment, but someone mentioned how sort of it's hard enough getting treatment as an individual, and I'm going to ask a question off the back of this that. With many people sort of either being in denial or not aware, obviously that is quite hard to get treatment. How can we help other people get treatment? Because certainly, we had a dementia webinar I was a part of recently where people had shared how it was difficult for them to help other people because they weren't that person and that person wasn't seeking help. Do you have any advice on how we can encourage other people to get help if they do? So if they mention they're experiencing this but are scared of taking that next step?
yeah, I think a couple of things. I think the first thing is to mention that some people might not be ready. They need to be motivated and they need to be ready. I think with any, condition sort of this kind. So I think all you can be sort of is understanding, be there, be supportive, and be listening for when they are sort of ready. So sometimes people aren't really ready to take that step because, as we discussed, sometimes it is kind of working for them, and they're very secretive. So I
Mm,
think it's being a little bit sort of sensitive there. I think otherwise it's just like we've discussed a little bit. It's about having, it's creating an environment around there where they reducing that sort of stigma, where they feel comfortable opening around those sort of conditions.
mm.
and just trying to supporting them through every kind of step of the way to try and get the help which they sort of need. But you can't force someone to get help if they're not really, I guess, ready for it.
Yes.
To do it themselves. But and there are barriers to treatment. You said it's quite difficult. You can get private healthcare, or maybe it's provided through your employer. Um,
Mhm.
but there are services or charities available who can support. So
Fabulous. There's three more questions. Two of them are very similar, so I'm going to summarize them as one question. And apologies if you feel I misrepresent your question. But there's two questions that are kind of along the lines of: is sort of the standard sort of eating disorder CBT, does it help people recover? Or are people kind of always in recovery? Are they at risk of relapse? How effective is the start of the standard treatment?
that's the two questions in one.
Yeah.
Yes, so as I mentioned, so the evidence suggests that there's the most evidence to support CBT for the treatment of eating disorders. I think it depends a little bit of what stage of illness the individual kind of comes with. It
Mhm.
depends on the severity of their sort of symptoms. So usually CBT can be sort of adapted and personalized around the individual, maybe bringing in elements of other different kind of treatment approaches. So as I say, if it's kind of more severe or more kind of treatment resistant, a more multidisciplinary approach can be required, maybe involving nutritionists, or say specialists in whether it's dialectical behavioral therapy or different treatment approaches, really
Yes.
try and help that sort of individual. But yes, I mean, more generally speaking, CBT does help address those kind of underlying sort of mechanisms. And yes, of course, sorry, also you asked about sort of relapse and recovery. Yes, I mean, it's difficult because I think sometimes I speak to people in recovery. They never really admit to being in recovery because it's an ongoing sort of struggle for them. They're always mindful and always managing, and just I think like we all learn to do is managing our mental health really on a daily sort of basis. Um, so whether they actually can recover or in recovery, I think that's also sometimes they sort of opt in, to choose that, never really think of themselves as recovered,
Yes.
because it's not necessarily the approach to do so. But yes, there's a lot of evidence to support CBT, but yes, there is the risk of relapse, and it needs to kind of be managed.
Thank you. And the last question, and I really appreciate this individual who's shared a personal experience, obviously anonymously. It says, that they're not overweight themselves. They focus on fitness, but they do have a hard time making good food choices and often binge on junk food and feel elements of guilt. And the question is, how can I educate myself and make building healthy, nutritious meals a part of my everyday routine? Um, I think, yeah, the question itself, I mean, should we feel guilty if we eat junk food once in a while? Not re We shouldn't, should we?
No, so I think there are a few things here, isn't it? I think one is sort of about self-compassion, about
Hmm.
not seeing food as, I think as right food or wrong food or bad food or this food. Food is food. Food is fuel. Food. So it's helping developing a kind of more healthy sort of relationship with food and
Yeah.
allowing yourself, yeah, whatever treats or something, and being sort of kind to yourself. I think, but you do sort of say, I think meal planning can also be an important part of someone's sort of recovery. So I think, you kind of get access to kind of meal planning sort of tools. I know you
Mhm.
mentioned I've been working with Thrive to help develop sort of content for to update the app at some stage. But
Yes.
yeah, meal planning tools is something which has come up. But again, it's difficult. It's difficult to provide, guidance which is suitable for everybody. But I think, yeah,
Yes, of
it's
course.
more structured meal plans. But again, not, as you say, not obsessing too much around.
Yes, I mean every meal doesn't have to have green spirulina powder in the drink, and not everything has to be nutritionally optimal all the time. Like part of life is that we for many of us, food is an enjoyable thing as well, and within reason and within control. If we're only eating junk food, that's not a good thing for our health generally anyway. But I think, as you said, the kind of the experience of the individual earlier who ate a sandwich and nothing happened, kind of recognizing that, yeah, that food is fuel, and we need to operate that sort of self care and not punish ourselves for not always eating optimal food all the time.
But I think having those regular meals, or planning those meals ahead, can be helpful for someone sort of
Certainly.
certain foods and sort of binges. So yes, some kind of meal planning support might sort of be helpful.
Wonderful. That is the last question we had. I am going to zip ahead quickly just to put the QR code on the screen for anybody who would like to access Thrive. All these slides will be available. I'll ensure that you have access to some of these things about Thrive, which on the balance of things, I'm glad I didn't go into. I'm glad we focused a lot more. Obviously, with Thrive, you have access to talking therapy as and when needed, as well as CBT and other tools to help manage stresses. That does bring us to the end of today's session. And I'm really grateful, Pamela, for your time. It's been a great experience for me, learning more about this and sharing this session with you today. And I've certainly learned a lot more about eating disorders. I've hope that all those attending have had a great experience and learning as well. The recording will be made available to those who have attended. If you'd like to share this with colleagues, in particular, line managers, people who may have those conversations with colleagues who could be more aware of eating disorders, I certainly recommend that you share the recording with them. Otherwise, I think we have run over, but that's okay, isn't it? Thank you so much, Pamela, for today. We've really appreciated your insights, and I sincerely hope that whether it's helping you individually or someone else you've got a great deal out of today's session. Wonderful. I'll let everybody go then. Thank you so much all, and we will hopefully see you again soon, Pamela, for another session sometime.
Brilliant. Thanks so much.